Following reports of GP surgeries running low or even out of this year's flu vaccine, West Midlands health chiefs say they are working to ensure that anyone who needs it can get vaccinated. Those in the at-risk group who are being targeted for the vaccination this winter are people aged 65 or over, pregnant women during any stage of pregnancy, people living in a residential care home or the main carer for an older or disabled person, and those with long-term conditions such as heart problems or kidney disease. Anyone who does not fall into these categories can still get vaccinated, but has to pay for it privately at high street pharmacies. According to NHS West Midlands, there are still around 25,000 doses of this year's flu vaccine in stock. The jab provides protection against this season's 3 most prevalent flu strains: influenza A, influenza B, and swine flu.
We've been well stocked in this surgery, but certainly I think in the UK generally, but certainly in Wolverhampton there's been a number of practices that have run out, and we've actually in the last 3 or 4 days been able to provide about 200 vaccines to 4 or 5 practices who rang and were short.
There are also 250,000 doses left of the H1N1 vaccination, which was used during the swine flu pandemic last spring. This winter, swine flu cases are not at pandemic levels, but the seasonal vaccine still carries protection against this particular strain.
Because the flu that is circulating right now is the same virus, or at least some of that flu is the same virus as last year, then the vaccine from last year will work against that particular virus.
Orders for this winter's jabs had to be placed as far back as last March. Drug companies will only take back 10% of unused stock on a sale or return basis, so GP surgeries waste money if they try to play safe by ordering huge amounts of the vaccine, just in case.
I think we've probably done exactly the same as have, I suspect, all GP practices this year as we have in estimating it every year. And it is difficult to know what factors are going to affect it. Last year we had the swine flu and there was quite a lot of people who didn't want to have the swine flu vaccination. This year the swine flu element is incorporated in the seasonal vaccination, so you don't know whether actually some people might decide they don't want it because of that, or because of fears of recurrence of swine flu, more people will. They're all unknowns and it's really difficult to gauge.
High street pharmacies have also found it difficult to estimate demand for the flu vaccine. In a quick telephone survey of 20 Lloyds, Boots and Tesco pharmacies in the West Midlands, NHS Local found that all had run out of vaccine. Some people choose to buy the vaccine from a commercial chemist, but some GPs don't think that it should be available through the private sector.
It sends a confusing message to provide, the vaccine privately, I think, and really encourages people who are not in the at-risk groups to come forward.
However, there is no question about the importance of hospital staff getting vaccinated. For an already ill patient, the impact of catching flu can be very serious. For the second consecutive year, Birmingham Children's Hospital has seen the highest uptake for flu vaccinations among staff in the country, with 98.7% of the hospital's 3,000 plus workers getting immunised.
What we've tried to do is have mobile teams moving throughout the hospital. We've also had staff working on most of the wards who are immunisation trained, and we really believe that it's the availability of the vaccine sort of day and night that has been a real key.
The creation of 30 immunisation champions has also been an important factor in encouraging staff to get vaccinated. Champions are well-known, respected nurses who provide reassurance to colleagues and give them a better understanding of the value of immunisation.
I've noticed a lot of people that I did go and ask said no straight away, whereas when I explained to them exactly the side effects and why we were asking for them to immunise, it was a yes straight away. So I think it's not coercing them, it's actually giving them the information for them to choose.
I wouldn't be professional in doing my role if I was passing on those sort of illnesses to people through not having a vaccine through my own admission.
With a higher than expected national uptake of 71% for the over 65s, it has been suggested that government and media publicity has been too successful. However, there has only been a 46% uptake in other at-risk groups, and the Department of Health is urging at-risk people who have not yet received the jab to come forward.